Welcome to the 2021 MKA E-Class webinar on surgical skills. My name is Sori Moon, your master of ceremony for today's event.
Greetings to all participants and viewers. I am Dae-Jwa, Director of Global Healthcare Business Department at KD.
And the linear stapler line are overwrapped.
The lever to downward traction. Also retract the xiphoid port during mobilization.
Inside entry hole was closed. The entry hole was closed.
So we'll have a Q&A session from now on where they answer pending questions from our students.
Actually, the introduction of MIS in the field of rectal cancer, including low rectal cancer, is more than 20 years. Actually, so the penetration rate of MIS in rectal cancer in Korea is...
So in cases with the normal anatomy, vertical stapling is important, which means the vertical direction of the
Anastomosis by layer suture, but nowadays almost all gastric cancer surgery have been done with the laparoscopic or the robotic surgery.
And I would like to thank everyone as well who joined until the end and our participants for enthusiastically giving us questions. And with all these questions, and we'd like to wrap up all these procedures for this online MKA E-Class webinar on surgical skills. And thank you very much once again. And please continue to give your love and support to the online education. Especially once again, we would like to thank to our three professors. Thank you very much.
Thank you very much. Thank you.
Bye-bye.
Thank you. Bye.